Well, shall I introduce you? Fadi, thank you very much for agreeing with this. We're going to have a little chat, casual chat, about yourself, really, if that's all right. I know you love talking about yourself.
Thanks, Carl.
And sort of where it all started and where we are now with what VSSacademy are doing. Well, where did you start? I mean, where did you do your MSc? Where did you start your MSc?
I did my MSc at UCLan, funnily enough. But the way the whole VSS thing started, it goes right back to when I was studying medicine at Charing Cross. It finished off as Imperial, but while I was studying, I worked as an oral surgeon, and then I started getting into implantology. That was in '98. Started placing implants, and the whole thing about the visiting specialist developed because I thought I'm visiting lots of practices, doing MOS and implants and kind of making a living out of it, and it's a good system. It's a good and now it's obvious a lot of people do it. But at that time there weren't that many people going around, particularly with implants, placing implants. So at that point I thought, actually, wouldn't it be great if I get a team of people I trust to work with, and we all go out and do implants, make it into a business. That's basically.
So that started in '98 with just you.
So and then gradually by 2002 I left hospital. Got married, and all of a sudden my whole outlook changed. I didn't want to pursue the maxillofacial pathway any longer, because I wanted to go into the implant side of things with kids on the way and so on. The whole outlook.
Was it the kids, or was it that you just enjoyed doing the implants more than the?
It was surgery? A combination, because I loved it. I absolutely loved the implants because it had the surgery, it had the sinus grafts, it had the block grafts, it had the prosthetic aspects, it has a bit of perio obviously involved in it, and most aspects of dentistry were involved in it. And there was a lot to learn and lots of challenges. So it was interesting. It was challenging enough. And on the other side, I thought, actually, the kids are coming along on calls and being away from home for 3 months at a time and so on. It just, the appeal changed. My perspective changed. The perspective on life changes, doesn't it? When you have family on the way and so on. So I made the hardest decision of my career to hand in my resignation.
Okay.
So I actually resigned from hospital, which was a tough decision. But
which hospital was that?
I was at West Middlesex at that time, doing general surgery.
So did you feel that was quite a risk? It
was scary.
Was it a bit nervous and
very,
because you're giving away I'm not trying to put words into your mouth. I'm just trying to work it out. So you're giving away an employed status. Where you've got the safety net, or you think you've got a safety net, because obviously they can tell you. It can change. That can change. So you're giving that away, and then you're going out on your own. As totally self-employed. But you're not reliant on being within a practice and that protection of being an associate. You've got no protection because you're going away and you're visiting practices. And you're hoping that you get on with the people that you're working with. I know a little bit.
You've done it as well.
Because I'm doing it. Maybe I should ask you a few more questions. For me, when I did that, it was very nerve-wracking. I mean, for me, I thought this could be me going back into being an associate again. I'd always got that safety net, I suppose. I always knew that I could drop back to something that I did not want to do anymore. But it was always there. I don't know whether you felt the same. But it's still a big step, isn't it? It's
scary.
It's scary. But do you look back and think at any point that it's something that you regret, or did you have any point where you just thought, I wish I hadn't done that?
No, there are points where I've missed aspects of it, definitely. I mean, I love maxillofacial surgery. I loved it. I mean, I was one of those guys who would go in my free time and watch and assist. And it's a bit sad. I didn't do it every Friday night, but some Friday nights I went out and did extra suturing in A&E. In those days you could, as a student even, I would go, I want to get good at suture. So I absolutely loved it. I couldn't have enough of it. So I miss aspects.
Sorry, I'm interrupting you a little bit, but do you think those opportunities are still there for those people that want to do that? Or are they a little bit harder now?
It's harder.
Yeah.
Much harder.
I think so.
Yeah.
I mean, I guess we were lucky.
Yes.
Because we've just said that we're both the same age.
Yeah.
Which I think...
Although you look much younger than I do.
I told you to put the makeup on. That's the only reason I look like this.
This is with makeup, mate.
But one of the things that I found when I was at dental school is that you could go in and do extra sessions, which you can't do anymore.
No.
The regulations have changed and they've kind of stopped that, which is a shame. I look back on that and I think for those people that were really keen,
yes,
you had that opportunity, and it was the same, I guess, for both of us. You had the opportunity to go in and do those sessions, whereas now you've got so much red tape.
Yeah.
And I hope people listen to this and take note of this. So for those people that are keen and they do want to really relish what they do and they do enjoy what they do and they want to be better than what they are, the steps they have to go through are much harder.
Yeah, I totally agree. So, and also, to be honest, let's face it, the workforce is needed.
Yeah.
So I remember when I went to help in the A&E sessions, the doctors were delighted.
Yeah.
Because, that means that freed them up to do other things. But I wanted to get good at suturing. They had somebody with a heart attack to have a look after and so on. So using, like you said, there's people who are keen to do extra sessions, whichever way it might be, whether it's to do extractions or suturing, whatever it is, then to use them in a wise way, actually, we should look at that somehow.
Yeah.
But it needs a bit of planning, it needs a bit of kind of clever thinking to try and make use of enthusiasm and not crush it, really.
I agree. I mean, how would you feel? Do you feel that the extension, I mean, when we look at the support staff, I know that the people that assist me would love to suture those patients. And I'm talking about the nurses that I work with. They're desperate to get their hands on those sutures and suture up. And I don't see why we couldn't look at that in the future of giving those skills. Because it does then free us up as the clinician to go and plan.
That's a good point.
So it's something that I could see their skills enhancing in the future with the right training, if only the people that were sort of looking down and making these regulations might just open their horizons up a little bit.
We need to think out of the box a bit, be more innovative and imaginative with things, and the nurses can do certain stuff now, which most practices don't use them for. But apart from the radiographs, they can take models. So they can do impressions for models. They can do a lot more than they do, which makes it more interesting for them, as well as save time for us.
I was doing a lecture on digital dentistry, and I know you're doing that today here. And one of the things that I thought was quite sad, really, was one of the clinicians was telling me that in the practice they work in, the nurses and the support staff are trained with the digital scanners. Yeah. So they can take the scan, which effectively is a photograph. Yeah. But the clinicians won't let them use the scanners, which I think is slightly short-sighted, because fine, I get it when it's a gadget and it's a new toy, and you want to play with it, but they're past that stage.
They've been trained. Yeah.
They've been trained, so they can take the scans, they can take the impressions, they can do the radiographs, and I think using that skill set and I think that makes for a better work environment. Yeah. Personally, I don't know whether you agree.
No, I totally agree. I think I think.
We've got deep quick, haven't we?
I know, that is deep for me anyway. I think it is worth looking at. I like that thought that you can actually make them more of your team. Yeah. I mean, I remember days even in hospital when we had nurses who were able to put cannulas in, but they're not allowed to. I was thinking, absolute. It was just nuts. Yeah. Thinking. We've got people with the skills, we need the skills, and yet, they're not allowed to do it. So if they've got the skills, they can be trained for it. I'm all for that.
Yeah. And I took us off track a little bit.
That's all right.
So we were talking about your sort of, before we got to your MSc, about the work in practice and the sort of stepping out of your comfort zone.
Yes.
Stepping into that area where you had resigned your place at the hospital, and you how many practices was that you were visiting at the time?
At that time, well, when I resigned, I only had a handful that I was going to.
And this was just yourself at the time?
Just myself, and it was scary on various levels. One, because of thinking, okay, I'm self-employed now, I've got nothing to go back to, and employment's stopped, and also the career is at least put on hold. I mean, I could have gone back, so I could have given myself a year if it doesn't work out to go back. So it wasn't completely free-falling. I had a parachute, so to speak.
Yeah.
So I basically started with that. Then what I did, I started to speak to colleagues, friends, go to meetings. And as I met dentists, they introduced me. Actually, most of it grew organically through word of mouth.
Yeah.
So, one colleague would say, actually, I've got a mate who needs somebody to place implants for them and to do manual surgery. In those days, not many people were providing implants. In fact, I remember having to convince some people that actually we should look into providing implants at the practice. So that's how it organically grew. And then I got other people on board. So when I got really busy, I thought, right, let's make it into a bigger thing.
Yeah.
Gradually, I got more colleagues on board and thought, okay, let's call it something, and that's why I call it VSS, Visiting Specialist Services.
Yeah.
In those days, basically, it did what it said. It does, visiting specialist services. It wasn't always specialists, but they were doing specialist type treatments. So
yes.
Perio. Yeah. At some stage, we were doing endo as well, but manual surgery, implants, those were the main things.
Yeah.
So once it grew to that level, then it came to a stage where I was placing and restoring. But the colleagues I was working with were interested, so I started training them into the restorative aspect. Then slowly, we decided, actually, let's run a course to train our colleagues to do the restorative aspect as we place. It makes us more efficient. Working in a team is more efficient. Again, our ethos with VSS has always been, it's got to be win-win. So the patient has got to be winning out of it, which is the primary thing, and then the practice got to win. If those two win out of what we do, we will inevitably win out of it. So that was the philosophy from the beginning. If I look after the patients and the practices, then
they'll look after you.
They'll look after us. So, and that was it worked. We did and everybody coming on board, yourself included, when we worked together. So we have the same philosophy. We want to sleep easier, and we do the best we can on every level. Then everybody's going to be winning out of it, and it just grew organically. Then we thought, right, now that people are restoring, started running courses, then developed it further and further into doing implant courses, and I got involved with UCLA in 2012, 7 years ago.
7 years.
7 years, I know. I looked much younger before, and then